Thank you for joining us for Orion Outreach. Our guests are Megan Szalony and Amelia Jackson with information about Oakland County Youth Mobile Crisis Team. Ms. Szalony is a social worker, project coordinator, and advocate at Oakland Community Health Network. With experience in child welfare, mental health, and juvenile justice, Megan is dedicated to improving crisis resources and supports for individuals with families in Oakland County. Megan supported the 2018 launch of the Mobile Intensive Crisis Stabilization Service project in Oakland County and works with Oakland County Youth Mobile Crisis Team that provides mental health to individuals and families during a crisis. Amelia Jackson currently serves as a clinical supervisor of the Intensive Crisis Stabilization Program at New Oakland Family Centers. Her primary responsibilities includes managing the day-to-day clinical and administrative operations of the ICS program. Amelia served as the first clinical therapist on the Crisis Stabilization Team launched in Wayne County and has assisted in growing this program ever since. New Oakland could not be happier to be able to partner with Oakland County to help deliver mobile crisis services in Oakland County. Welcome, ladies. I'm so glad that both of you are on the program today.
Thank you, Penny. Appreciate the opportunity to be able to share with the community about the Oakland County Youth Mobile Crisis Team. So thank you so much for having us.
Yes, thank you.
Absolutely. So how did this launch in 2018?
Well, this is a state mandated service, and so we were required by the Michigan Department of Health and Human Services to roll out this program, but it is definitely a critical need for families to be able to have a crisis support that's mobile, that goes out to them in the community. And so we were so happy to be able to partner with New Oakland Family Centers to be able to provide this service for our citizens and our community in Oakland County.
This is fantastic, and you're engaged in this with Wayne County as well, Amelia.
Correct, yes. We've been doing Wayne County for over 6 years now, and so we've really tried to perfect the program as much as we can. There's ongoing improvements that are being made, but now with Oakland County, we're adding another big county under our belts, but we're so happy to be able to help the consumers there too now.
It's an excellent partnership. People need to talk about mental health. How do we get the conversations going?
Absolutely. It's really to destigmatize just mental health and mental health disorders. And so if we make it a part of just talking about physical health and that mental health is no different, it really helps people open up. So similar to if someone said, you know, I have diabetes and it's a chronic condition, they can talk about whether it's depression, anxiety, or another mental health condition, and that really it's no different. Maybe the treatment looks a little bit different, but just if we normalize that discussion, that can really break barriers. And that's why we want people to be able to access mental health services and supports, and really get them connected so that they do have great mental health and we can promote mental health as well.
And how can people find out more about this?
With the Oakland County Youth Mobile Crisis Team, they can visit our website, which is oaklandchn.org, but then also through New Oakland Family Center's website as well. And then if they are in crisis, they can contact directly the New Oakland Youth Mobile Crisis Line, which is a 24-hour line, should they want more information about the service as well.
Fantastic. And Amelia, what does it look like when this crisis team is mobilized into communities?
So once our 877 crisis line is used, and we do a short triage phone assessment, and we can deploy out into the community, then our team of 2, there is a master's level clinician and a behavioral tech who go out to the home, and they do crisis intervention, stabilization techniques with the youth and the family, and really try and get a treatment plan that involves the whole entire family, but also that really is directed towards stabilization outside of going to acute levels of care. So whether that be a partial hospitalization program or an inpatient admission, which are sometimes, of course, needed.
Yes.
We really try and keep the families engaged within their community, but with ongoing support. Which really, goes back to their core provider or getting them linked with a core provider if they don't have one already.
That's good to know. And we know when there is a stabilized community, when people have sound mental health, that the resources on some of our first responder calls will go down.
Absolutely, and we definitely want to be working with our police departments and our local law enforcement agencies, and also with the fire department, EMS. We work very closely with our community hospital emergency rooms, just let them know about this service as well, because it is mobile, so it's great that the service can go out to family residences, schools, foster care homes, practically anywhere in the community wherever a family and a child or youth is experiencing a crisis. So we really want to partner with our community members and our stakeholders to ensure that they know about this service as well.
That's good to know. And you said the state mandated. Can you talk a bit about that?
Yes, and so the state looked at different models, and they looked at a Milwaukee model to say what helps keep children and youth in the community when they're experiencing a crisis situation. And so from looking at other state models and also New Jersey, they said having a mobile team really helps to not only prevent inpatient hospitalizations when appropriate, but it helps to be able to have communities have a resource that comes out to them, because so many times it's difficult when families may have multiple children just to get that child the adequate care they need, from a hospital, ER, or a crisis center. So bringing it to them is so beneficial. So they found that it helps have a mobile team to de-escalate children and youth in the community, helps keep children and youth in the community, and also can reduce the need for inpatient hospitalization when appropriate. And so the state really saw this and said, how can we better support youth and families in our communities and in the state of Michigan? And so they were really eager to put this service in place in our communities, so it is available across the state in every single community in partnership with their community mental health organization in that county.
And that's so important. How are you spreading the word about this agency?
We have done so with direct communications with our marketing departments at Oakland Community Health Network, with New Oakland Family Centers, doing mailings to families, working with law enforcement, schools, working with the press. I know we just had an article released in the January edition of the Metro Parent, and so just continuing, and word of mouth is some of the best, promotional avenues to really get the service out. And so as family members, parents, school social workers, and the hospitals have utilized the service, word of mouth is really generating, more calls, and for New Oakland to be able to really assist more families. So it has really been a great partnership.
I'm glad to see the awareness increasing. We have a problem in a lot of communities where people are struggling with drug and alcohol addictions. Is this something that they can get service with, so you can get them at least directed to where they need to go to get help?
Absolutely, and if youth or family, any individual in between the ages of 0 to 21 can access this service. And there are some insurance pieces as well to that. But if they are facing any type of substance use disorder, they can call, and depending on what the crisis situation is, they'll get in contact with, should the individual need immediate transport, are they going through some detox. But then if they're finding out that maybe there's not an overdose situation, or it's not an immediate need, they'll make sure they connect the individual to the appropriate substance use disorder service. So it's a referral, if it's the sober support unit through Common Ground, or if it's through an outpatient provider, they'll also be able to connect that individual to the appropriate supports for that service as well.
That's good to know.
Yes.
People need help. Where are you branched, or where is your agency located, Amelia?
So we have multiple agencies across Tri-County, in Okemos, Flint, Ann Arbor. We have New Oakland sites. The Youth Mobile Crisis Team is community-based, so we're all over both Wayne County and Oakland County, in the community, in the EDs, kind of all over.
Very accessible. That's good to hear.
Yes.
And you've talked about some great agencies with Common Ground, and we also have a Crossroads Village where kids are at, and where they need some extra help.
Oh, absolutely.
And how do you interface with those groups?
We work directly with Common Ground for referrals, so if there's an individual already in the ER, they will almost dispatch the New Oakland Youth Mobile Crisis Team out into the community. So we work very closely with Common Ground, and then also they work closely for the continued stabilization. So should that individual need a crisis residential unit, a partial program, or an inpatient, they facilitate in working with that family once that decision is made. And so they work very closely. And with some of our other community partners, as far as like Crossroads for Youth, we definitely want to make sure families have this information for when they do go back home. But for certain areas like child caring institutions, juvenile detention centers, jails for our older adult population, the service is not able to go to there per a state mandate. So there's certain regulations on where the service can go and cannot. But they absolutely can go to schools, homes, residences, practically anywhere in the community except for child caring institutions, residential centers, which includes Crossroads for Youth, and then inpatient settings and any type of residential setting as well.
That's good to know.
Yes.
Anything that I haven't covered or asked you that you want to make sure that our viewers are aware of? We'll start with you, Amelia.
I think just the biggest thing would be to call regardless of whether or not you think it is a crisis situation or not. The master's level clinician will triage it over the phone, and if it's not a situation that we can deploy on, we're always going to give any type of support, suggestions, or referrals, resources that we can. So it's just calling no matter what and getting the support that you need, however that may look.
Taking the first step. That's so important. Yes. And once people take that step, they generally see that it's not quite as scary or daunting as they thought it would be.
Right.
And it's good to know the resources are available. Thank you. Anything that you want to make sure that we cover, Megan, so we get the word out there to people?
Yes, absolutely. Well, it is available 7 days a week from 2 p.m. to 10 p.m. currently. And so when, family members can call, whether it's the individual in crisis can call, but a lot of the calls have been coming directly from parents, caregivers, even foster care parents, or just school staff or personnel, even from hospitals. Anytime, as Amelia shared, anytime a family is experiencing a crisis, whether it's suicidal ideation or maybe the youth is presenting with depression, anxiety, anything in that parent's gut is saying, something's going on with my youth, I'm concerned. Give New Oakland County Youth Mobile Crisis Team a call, and even as Amelia shared, even if they're not able to deploy out, maybe the situation has already escalated beyond a point where maybe law enforcement's involved, they'll absolutely work with them and they'll get them triaged and connected to the appropriate support, whatever that is. And so that's just important for families to know. Again, 7 days a week, 2 p.m. to 10 p.m. They can contact the Oakland County Youth Mobile Crisis Team at 877-800-1650. And so we just want to make sure that families, parents, and caregivers have that information because it's such a critical service for our community and especially Orion Township. So we're just so excited to be able to share the service today.
I really appreciate this opportunity. Grandparents are raising kids. There's a lot that's going on, and it's good to know that you have resources available. And then you find out, they're not alone. I think that's one of the biggest things, but also that people are connected to something that will be able to help and assist. I appreciate both of you taking the time to come into the studio and talk about this, and I hope that you're coming back again in the future.
Would love
Absolutely.
to. Thank you for having us.
And do you have resources available also in the schools?
Yes, we do. And if there's any social work department or counseling department that wants more, we have direct contacts, and we're more than happy to share that information in our flyer as well. The flyer is available online as well, so we just definitely want the community to know about it. So thank you so much.
Thank you, both of you. I appreciate you being here today.
Thank you.
Thank you, Penny.
I hope you enjoyed this edition of Orion Outreach. This was a fantastic opportunity for you to learn about this mobile Oakland County crisis team. And we know that you'll be able to benefit from that. Spread the word, tell your neighbors. If you hear someone struggling with mental health issues, please give them this contact information. They're there to serve you. Thank you, everyone.